Hello. Welcome to the Jornada de Cura channel. I am Dr. Anna, a physician graduated from USP with a specialization in nutrology from the Federal University of Sao Paulo. And today I will share something that has transformed the intimate lives of hundreds of my Brazilian patients. What I will reveal today is a natural method that has helped men over 55 regain their sexual potency without depending on medications with side effects. Knowledge that unfortunately few doctors share with their patients. I clearly remember Carlos, a 62-year-old entrepreneur from Sao Paulo who came to my office after trying various conventional treatments. He was frustrated, his self-esteem was shaken, and his relationship was suffering. After implementing the natural method I will share today in just 3 weeks, he sent me a message I will never forget. "Doctor, it seems I've returned to my 40s. My wife doesn't believe the transformation." This knowledge combines traditional Brazilian wisdom with the latest scientific discoveries about male vascular and hormonal health, a method that our ancestors knew intuitively but was forgotten with modern medicine and its preference for quick pharmaceutical solutions. Before continuing, if you want to receive more content about integrative men's health, click the subscribe button and turn on notifications. And tell me in the comments which Brazilian state you are watching from and your age. We are building a community of men determined to take care of their health naturally. Last week, I received an emotional testimonial from Mr. Antonio from Belo Horizonte, 67 years old, who implemented this method 2 months ago. He wrote, "Dr. Anna, after years of frustration and shame, I can finally say I feel like a man again. I've regained my dignity, and my marriage has a new life." Over my 25 years of experience, I have treated men from all regions of Brazil, from different social classes and lifestyles. What I discovered is that, regardless of differences, male potency problems after 55 have common roots that can be treated naturally and effectively. Several studies from UNIFESP, USP, and FAM confirm what I have observed in clinical practice. Natural approaches can be as or more effective than medications for many men, without the unwanted side effects. Let's first understand what really happens to the male body after 55. Many men don't know, but the penis functions as a sentinel of cardiovascular health. Erectile problems are often the first sign that something is not right with your overall circulation. Erections depend on a healthy vascular system. When you get excited, blood needs to flow quickly to the cavernous bodies of the penis, filling them and causing rigidity. For this to happen perfectly, you need flexible and responsive arteries that dilate rapidly, adequate nitric oxide production, the molecule that signals blood vessels to relax, sensitive nerves that transmit signals correctly, and proper hormonal balance. As the years pass, natural changes occur in this system. Arteries lose elasticity. Nitric oxide production decreases. Nerve pathways become less efficient. Hormones fluctuate. This is like a river that becomes narrower and more obstructed. The water still flows, but with less force and speed. The concerning fact is that, according to research from the Brazilian Society of Urology, 52% of Brazilian men over 60 face some degree of erectile dysfunction, but only 25% seek help. And among those who do, many only receive medication prescriptions, without guidance on how to treat the underlying causes. Here's what many doctors don't tell you. Erectile dysfunction can be an early warning of heart problems. Studies from USP show that men with erectile problems have a 50% higher risk of developing cardiovascular diseases in the next 5 years. The penile arteries are smaller than the coronary arteries, so they show signs of obstruction earlier. And this is where the problem with the conventional medical approach lies. When you take a medication for erectile dysfunction, you are only forcing a temporary response without treating the root cause. It's like increasing water pressure in a clogged pipe instead of unclogging it. These medications can cause headaches, nasal congestion, digestive problems, altered vision, and in rare but concerning cases, priapism, painful and prolonged erection, and sudden hearing loss. Additionally, many men develop a psychological dependence on these medications, losing even more natural confidence. In my clinic in Sao Paulo, I treated Mr. Roberto, a 58-year-old university professor who suffered from severe headaches and dangerously low blood pressure due to these medications. He told me, "Doctor, the cure was worse than the disease. I could have relations, but I spent the next day in bed." Another problem is the limited time of medical consultations. With only 15 or 20 minutes, many doctors opt for the quickest path, prescribing a medication and ending the discussion. There's no time to discuss nutrition, exercise, stress management techniques, or natural approaches that could solve the problem more permanently. Modern medicine is incredible for many things, but it tends to fragment the body into isolated systems. The urologist takes care of the reproductive system, the cardiologist the heart, the endocrinologist the hormones. But in traditional Brazilian medicine, it has always been understood that the body is an integrated system where everything is connected. Our traditional Brazilian communities have always had a holistic approach to men's health, from the Indians of the Amazon to the Quilombolas, from the Caiçaras to the Pantaneiros. There is valuable knowledge about how to maintain male vitality naturally, even into old age. During research I conducted in the Alto Rio Negro in the Amazon, I met communities where men in their 80s and 90s maintained impressive vitality. I spoke with So João, a 92-year-old shaman who shared with me recipes for therapeutic oils used for generations to maintain the strength of man, as they call it. Researchers from UFAN and UFPA have systematically studied this traditional knowledge, identifying bioactive compounds in Amazonian plants that have proven effects on vascular and hormonal health. What was once considered folk knowledge is now being validated in laboratories with rigorous scientific methodology. But before we get to the solution, we need to understand what is sabotaging your potency daily. There are true silent killers of erectile function that many men don't notice. The silent killers of erectile function. Modern Brazilian diet. We have replaced the traditional diet based on whole foods with ultra-processed foods rich in trans fats, refined sugars, and preservatives. These foods cause chronic inflammation in blood vessels, making them less responsive and more prone to blockages. A study from USP analyzed the typical diet of urban Brazilians and found that we consume, on average, 5 times more inflammatory foods than our grandparents did. Every time you consume these foods, your blood vessels become less flexible for up to 6 hours afterward. Sedentary lifestyle. The average urban Brazilian spends 9.3 hours a day sitting, according to research from the Ministry of Health. This compresses the arteries and veins in the pelvic region, reducing blood flow to the genital organs. It's like bending a hose. The water simply doesn't flow. Additionally, lack of movement causes the pelvic floor muscles to become weak and tense, further compromising local circulation. Chronic stress. In the frenetic pace of Brazilian cities, we live constantly in fight-or-flight mode with elevated cortisol levels. This stress hormone constricts blood vessels and blocks testosterone production. A man with chronically high cortisol levels can have his testosterone production reduced by up to 40%, according to studies from UniFes. Dehydration, surprisingly common in Brazil, despite the tropical climate. We replace water with coffee, soda, and alcoholic beverages, which actually dehydrate us further. When you're dehydrated, your blood becomes more viscous, making efficient circulation difficult. Common medications. Many medications commonly used by Brazilians also negatively affect sexual function. Certain antihypertensives, antidepressants, antacids, and statins can impair circulation and hormonal production. I'm not suggesting you stop your medications, but it's important to know they may be contributing to the problem. Environmental pollution. In large Brazilian cities, pollution contains heavy metals and endocrine disruptors that interfere with the male hormonal system. A study from USP found high levels of toxic microparticles in the blood of men living in polluted urban areas, correlated with lower testosterone levels. Excessive alcohol consumption. Common in our culture, it also significantly impairs sexual function. While small amounts may relax and disinhibit, regular consumption affects hormonal production and damages the nerves responsible for erection. Prolonged use of electronic devices, especially before bed. The blue light from these devices suppresses melatonin, the hormone that regulates sleep and indirectly influences testosterone production, which occurs mainly during deep sleep. Natural allies for male potency. Now, let's talk about the natural allies of male potency that can be easily found in Brazil. Watermelon. Abundant especially in the Brazilian Northeast. It is rich in citrulline, an amino acid that the body converts into arginine, a precursor to nitric oxide. A study from Unicamp found that men who regularly consumed watermelon had 27% higher levels of circulating nitric oxide. Açaí and Brazil nuts. Treasures of the Amazon, rich in antioxidants that protect blood vessels and minerals like zinc and selenium, essential for male hormonal production. The Brazil nut is the richest source of selenium in the world. Just 2 nuts provide 100% of the daily requirement. Brazilian cocoa. Especially from Bahia, with a high content of flavonoids, a powerful natural vasodilator. A study from UFBA demonstrated that regular consumption of 70% cocoa chocolate improved endothelial function, the inner lining of blood vessels. Pomegranate and Brazilian citrus fruits, rich in antioxidants that improve endothelial function. Pomegranate juice has shown particularly promising results in clinical studies for male vascular health. Brazilian medicinal herbs also have proven effects on male vitality. Catuaba, studied by UFMG, contains alkaloids that improve blood flow and act as mild stimulants of the nervous system. Guarana, rich in natural caffeine and theobromine, improves energy and circulation when consumed in moderation. Kola nut, part of the Afro-Brazilian tradition, contains compounds that stimulate the central nervous system and increase physical endurance. It has been used for centuries as a tonic for male vitality. Techniques to improve pelvic circulation. In addition to diet, there are breathing and movement techniques inspired by indigenous Brazilian practices that can significantly improve pelvic circulation. Diaphragmatic breathing massages internal organs and improves blood flow to the genital region. Proper hydration. Essential in the Brazilian climate. I recommend to my patients the half rule. Drink half a liter of water upon waking, 1 liter before each meal, and 5 liters before bed. This simple routine ensures sufficient hydration to keep blood flowing freely. Therapeutic baths. An important part of our culture, they can also be powerful allies. Sitz baths with herbs such as barbatimão and aroeira, traditional in Brazilian folk medicine, improve local circulation and have proven anti-inflammatory properties. The mental aspect of sexual function. We cannot ignore the mental aspect of sexual function. The mind-body connection is particularly strong when it comes to erections. Anxiety, worry, and stress directly affect penile circulation, creating a negative cycle that is difficult to break. When a man has a negative experience, he begins to anticipate failure, generating anxiety. This anxiety releases adrenaline, which constricts blood vessels, exactly the opposite of what is needed for a healthy erection. The physical problem becomes psychological, and vice versa. Mindfulness techniques adapted from Brazilian tradition can help break this cycle. The flowing water meditation, inspired by riverside practices, teaches you to observe thoughts and worries as water flowing down a river. You notice them, but you don't cling to them. Communication with your partner is another often neglected aspect. In the Brazilian cultural context, many men were raised not to show vulnerability, making it difficult to openly discuss sexual issues. But my patients who learn to communicate their concerns report significant improvements, not only in sexual function, but also in the overall intimacy of their relationships. Emotional isolation is poison for male sexual health. Men who maintain close friendships and meaningful social connections have healthier hormone levels and less chronic stress, factors that directly impact erectile function. The natural method, restorative therapeutic oil. Now let's get to the natural method that has transformed the lives of my patients, the restorative therapeutic oil. I developed this formula over years, combining traditional Brazilian knowledge with modern scientific research. Initially, I worked with formulations based on the oils used by the shamans of the Alto Rio Negro. Later, I perfected the composition based on studies from Unicamp on the cutaneous permeability of essential oils. The complete formula consists of 2 tablespoons of organic extra virgin coconut oil, 3 drops of peppermint essential oil, 2 drops of ginger essential oil, 1 optional drop of cinnamon essential oil for potentiation. Each component has a specific scientifically proven function. Coconut oil is rich in medium-chain fatty acids that easily penetrate the skin and act as excellent carriers for the active components of essential oils. A study from the USP School of Pharmaceutical Sciences demonstrated that the medium-chain triglycerides in coconut oil increase cutaneous permeability by up to 80%, allowing bioactive compounds to reach deeper tissues. Peppermint essential oil contains menthol, a natural vasodilator that creates a refreshing sensation. This stimulates the cold receptors in the skin, triggering a compensatory warming response that increases local blood flow. Studies from UNIFES have shown that menthol can increase local microcirculation by up to 35%. Ginger essential oil contains gingerol and zingiberine, thermogenic and anti-inflammatory compounds. They naturally warm the tissue, improve blood flow, and reduce inflammation that may be compromising vascular function. Researchers from UFMG have documented that ginger applied topically can reduce inflammatory markers by up to 43%. Cinnamon essential oil, optional. Cinnamaldehyde is a powerful circulatory stimulant, but it should be used with caution due to its potential irritant effect. Preparation is simple. In a glass bottle, add the coconut oil. If it is solid, due to temperatures below 20 degrees Celsius, Gently warm it in a double boiler. Add the essential oils in the indicated proportion and shake gently to mix. Close the bottle tightly and store it in a cool, dark place. In the Brazilian climate, I recommend keeping it in the least cold part of the refrigerator during the summer to preserve the properties of the essential oils, which are volatile and can degrade with excessive heat. You can find all these ingredients in natural product stores, compounding pharmacies, or even in large supermarkets in the natural products section. Always opt for therapeutic-grade essential oils, preferably organic and from recognized brands. Application technique. The correct technique is as important as the ingredients. The proper method maximizes absorption and therapeutic benefits. Adequate preparation. Perform the application after a warm, not hot, bath. Excessive heat can irritate sensitive skin. The bath naturally dilates blood vessels and cleans the skin, preparing it to better absorb the active components. Create a calm environment, free from distractions or haste. This is not just a physical treatment, but also a moment of reconnection with your body. Many men are so disconnected from their own bodies that they barely take time to consciously care for themselves. Warm the oil. Rub approximately half a teaspoon of the oil between your palms for 10 to 15 seconds. The heat from your hands activates the components of the essential oils and improves absorption. Application. Start with gentle circular motions at the base of the penis, where it connects to the body. This area, called the penile root, contains the main blood vessels that supply the cavernous bodies. Use moderate pressure, enough to stimulate circulation but not so strong as to cause discomfort. Gradually work toward the glands with long, firm, upward strokes. Imagine you are directing blood flow upward. Pay special attention to the lateral areas of the penile shaft, where important veins run. For men with reduced sensitivity, gentle circular motions on the glands may be helpful, but be careful, as this area is more sensitive and may react more intensely to the essential oils. Duration and frequency. The ideal duration is 10 to 15 minutes, and the recommended frequency is daily, preferably at night before bed. Your body does much of its repair work during sleep, so applying the oil before bedtime enhances its effects. Breathing technique. During application, practice the 4-7-8 breathing technique. Inhale through the nose for 4 seconds, hold for 7 seconds, and exhale slowly through the mouth for 8 seconds. This breathing activates the parasympathetic nervous system, the body's rest and digest mode, which is essential for healthy sexual function. Positive visualization. Add positive visualizations during the process. Imagine blood flowing freely, tissues regenerating, and cells revitalizing. Your brain responds to these mental images, creating a biochemical environment favorable to healing. Adjustments for different body types and conditions. Sensitive skin. Start with a greater dilution, more coconut oil, fewer essential oils. Compromised circulation. Benefit from a gentle massage on the inner thighs before applying the oil to the penis to stimulate overall blood flow in the region. Expectations. Results are not instantaneous. This is not a synthetic drug that forces an immediate response, but a natural support for your body to heal and restore its normal functions. Expected timeline of results. First 7 days. You will likely notice pleasant warming and cooling sensations as the oils penetrate. Some men report mild tingling and increased overall sensitivity. This is the beginning of tissue awakening. Days 8 through 14. Many men begin to notice an increase in the frequency and firmness of morning erections. Morning erections are an excellent indicator of vascular health, as they occur naturally during sleep when penile blood flow increases. Days 15 through 21. Results tend to become more consistent. Sensitivity improves, erections become firmer and longer lasting, and many men report the return of sexual confidence. It is during this period that most of my patients begin to notice significant improvements during sexual relations. Remember, each body responds at its own pace. Factors such as age, initial vascular condition, hormonal levels, medications in use, and lifestyle influence the speed and extent of results. In addition to improvements in sexual function, many men notice additional benefits: better mood, more energy during the day, more restorative sleep, and even improved concentration. This happens because vascular health affects all body systems. To track your progress, I suggest keeping a simple diary. Note the frequency and quality of morning erections, changes in sensitivity, firmness during arousal, and any other benefits you observe. This record not only helps in evaluating results, but also positively reinforces the improvements achieved.